Hello, my name is Benohanian. I'm a dermatologist at the Montreal University Hospital Center since 1974. Being in charge of the phototherapy center for almost 4 decades, I've come across many cases of psoriasis. And as you know, nail psoriasis affects up to 50% of patients who suffer from psoriasis, and it can seriously affect their quality of life. Current treatments are limited, and there is no standard course of therapy. In the last couple of years, I've successfully treated nail psoriasis patients with a low-pressure, versatile jet injector, the MedJet MBX from MIT, Canada. At the same time, I've been treating focal hyperhidrosis since 1978 with extemporaneous topical formulations. Although clinicians contentedly treat axillary hyperhidrosis with Botox injections, many of them are reluctant to treat palmar hyperhidrosis. The ability to inject Botox on the palms and soles without causing pain to the patient is an important feature in the treatment of palmoplantar hyperhidrosis. In this case too, I found the low-pressure versatile jet injector of great benefit, and I thought it would be useful to share that experience with you along with a few other treatments. Why needle-free injection? Mainly to alleviate pain during injection and also to neutralize needle phobia. As you know, 24% of adults and 63% of children in the US are fearful of needles, and this has a direct impact on immunization non-compliance. Jet injection may be used for painless injection of triamcinolone, for nail psoriasis, for alopecia areata, for hypertrophic scars and keloids, for generalized granuloma annulare, and necrobiosis lipoidica. Jet anesthesia may be used prior to Botox injection with needle in palmar and plantar hyperhidrosis. We can also use it to remove moles, skin tags, and other skin conditions like for small biopsies and stuff like that. The pain intensity is measured with the visual analog scale. Now, for jet anesthesia, if 0 means no pain and 10 means excruciating pain, usually patients report a pain score of 2 or less. As you know, a pain score of 3 is considered to be the boundary between mild and moderate pain. I'm going to show you how I treat nail psoriasis. As you see, we're injecting the matrix of the nail matrix with 2 or 3 and sometimes 4 injections. Each injection has a volume of 0.07 ml per spurt, and the concentration of triamcinolone I'm injecting is 8 milligram per cc. This is almost a painless procedure. As you know, nail psoriasis, that when it is injected with needles, it needs some kind of anesthesia, usually ring blocks. And here we don't really need any ring blocks, and it is done easier and much faster than the regular procedure. Vas-y avec un autre là. 1, 2, 3. C'est beau? Just to show you, the same patient who had an injection of nail psoriasis for her toenail, when we asked her to evaluate the pain, she gave 10 for the pain caused by the needle, and she gave 0 for the needle-free injection. Non, ça va, tu peux le faire. C'est beau. Okay. Non. Alors, c'est combien celui-là, puis c'est combien l'autre? Lui, moi, je vais le mettre à 10, là, parce que j'aime pas ça, puis oui. L'autre, 0. L'autre, 0. Bon, merci. C'est beau. We can use it for, as I mentioned before, for many other purposes. Here's a case of alopecia areata that you are all familiar with. We're injecting again here triamcinolone 8 milligram per cc in a much faster and painless way. Here we have a case of keloids, and also keloids, as you know, are difficult cases to treat, and they are also painful. With the jet injector, I think the treatment becomes much easier and much better tolerated. Non, ça sur l'os, on sent pratiquement
m'en viens. OK. Je vais faire ici l'épaule. C'est déjà pas mal. Attention à vous, je veux pas que ce soit d'appareil.
Non.
On s'en ici. Est-ce que c'est bon?
Here's a case of generalized granuloma annulare. As you know, generalized granuloma annulare is a difficult skin condition to treat. I'm asking the patient, how much would you evaluate the pain? And she is answering to tell me that it's not more than 2 on a scale of 0 to 10. There are many treatments, you know, and one of the simple things to do is the injection alone on the skin lesion. But injecting this patient with 80 to 100 injections would be a painful, really task. So that's why needle-free injector here help us to achieve our desire in a much easier way. This is a case of necrobiosis lipoidica in a needle-phobic patient. And this patient has always refused to be treated with needle, and we're injecting a triamcinolone with a needle-free injector. One of the advantages of the needle-free injector is to provide the needle-free anesthesia prior to injection of Botox with needle. My preferred way of treating hyperhidrosis with Botox is first to obtain the anesthetic papules through the jet injector, and then inject Botox with a needle, as you see. I use a 33 gauge needle here, and injecting about 2 units of Botox in each anesthetic papule for a total of 100 units per palm. This is a very easy procedure, and it really very well tolerated. It is very well tolerated by the patient. Now, if the patient is really needle phobic, then I have another way of treating the palmar hyperhidrosis. That would be by instead of having the anesthetic spot, to put the Botox directly into the syringe and inject Botox directly through the MedJet injector. Here's our needle-phobic patient who hates needle, and we've put the Botox inside the syringe. The reconstitution was 5 cc for the 100 units per vial, I mean, and it doesn't take much time. In almost a minute, a whole hand is done. I don't use this procedure very often for the simple reason that splash and splatter might cause some waste of Botox. So I wouldn't like to waste 5 or 10% of the Botox, because Botox, as you know, is an expensive product. But if the patient is needle phobic and there is no other way of treating him, I would use this method, because this method doesn't even give him time to get a thread. He has no time to get a thread. In a minute, everything is finished. Here's an upgraded equipment of the MedJet MBX, which is called the MesoJet. As you see, we don't have a trigger here, and we use the pedal to shoot our injections. You may appreciate that with 2 shots, we obtain a total anesthesia of the mole. And I'm going to cut it now and ask the patient if she feels any pain. And you're going to hear it yourself that there is no pain. Okay. Do you have any pain?
No.
0 pain?
0.
You tell me now if there is any pain. Any pain?
No.
0 pain?
0 pain.
And what about the injection? Was it painful?
No.
On a scale of 0 to 10, if 0 is no pain and 10 is the worst possible pain, how much would you get?
0.
Thank you. This is a skin tag. The same hole, we provide jet, and then we cut the skin tag Training is crucial for safe and optimal performance. Appropriate parameters must be used for each indication. I usually adjust my volumes to 0.05 to 0.1 ml. And we have to choose also a suitable pressure according to the skin thickness, normally in a range of 130 to 160 psi. It is crucial to become familiar with the mechanism of the jet injector device and its peculiarities before using it. A formal training is needed to learn best practices and become more skillful in creating a skin wheel. In addition, physicians should demonstrate aptitude in using the injector on actual patients. Here are some references on jet injectors that I have performed with MedJet MBX.